I think we can start with this particular disclaimer if we want. Um, Before we start this particular podcast slash episode, we're going to start with a disclaimer by saying the views and opinions expressed in this podcast are those of the host and their guests and do not necessarily reflect the official policy or position, institutions, or endorsement of any agency or organization. Any views or opinions are not intended to malign any religion, ethnic group, club, organization, company, or individual, and respect the fact that people's views and opinions are subject to change. So
Yeah,
you
that's
can take it away.
yeah, totally necessary. So, we will start with an introduction, and I'll start by introducing myself. And so, I am Naomi. Yeah, Naomi is short, and I'm from Nigeria, the northern part of Nigeria to be precise. I'm a trained medical doctor, and I'm studying public health right now in the Erasmus Mundus Joint Master's Program. And Charles, who are you?
So, yes, I had a brief introduction there. I'm Charles. I'm from the Bahamas. So, repping the 242. And I am a public health practitioner, a communications practitioner. And surprise, I'm also studying public health as part of the Erasmus Mundus Joint Master's degree program. So, Europub Health, which I'll encourage everyone to check out, and maybe we'll post a link to it in the video. And we'd like to introduce you all to this podcast, which we are calling Talk Public Health. And through this, we're hoping to achieve some key goals and aims. So maybe Naomi, you can take it away with goal or aim one.
Yeah, so as Charles rightfully said, I would emphasize that the Europop Health Program is awesome and you should check it out, and we'll post the link. And so one of the first aims of this podcast is actually to highlight key global public health issues. So we're aiming to address and to bring it up for discussions so that you will get to learn about some of those issues. And Charles, what next?
And just like Naomi said, we plan to use this platform to generate discussions and issues faced in various areas of the public health domain. And back to you, Naomi.
And then we will highlight like various areas and disciplines in public health, which we know is quite not really easy to understand. So we will try to do that in this podcast. And finally,
And finally, we hope to explore other global issues that affect public health. And just to give you all a bit of an idea with the format of these podcasts, we hope to keep them around 20 minutes to 30 minutes in length. And we're going to just bounce back between key public health issues. So the topic that we have for today is actually what is public health? And so perhaps like the first question that we can think about is how do people react to you at home or abroad, outside of your circle of friends, when you tell them that you are studying public health? Um, I think from my particular standpoint, uh, when I tell people that I'm studying public health, um, and even my family does this, and even some friends, they say I'm studying medicine. And as much as I love that particular area, that's not necessarily the case. I don't know. How about you, Naomi?
yeah, I think that's the same situation. I think it took a while for my parents to actually understand what I am studying after medical school because, of course, the the natural transition for medical students after medical school, then you go for a residency. And at some point, they were just like, "Oh, what's your residency?" And I'm like, "I'm not doing a residency. I'm doing a master's in public health." So it's generally really intertwined, and they're like, "What is that?" But I also think this is the problem is because most people that got involved with public health were also like from a medical background. So then people just tend to relate it directly to medicine. But I think increasingly people are beginning to understand what public health is all about. At least now I think there's more reception towards the field and people kind of still are lost, but they have an idea what it is.
Okay. And
Yeah.
uh, um, I guess why don't you take the other question because I feel as though uh, well, before we move on to that, I do believe that what you said, Sarah, is absolutely right. People know that my initial degree was a biomedical science degree. And so even then, trying to explain that degree, people hear medical. And
Mhm.
so the fact that I went on to then do a public health degree, uh, I I get called Dr. Charles back home, and I take it as I guess a sign of respect. But I like try to tell people that like, hey, I am not studying medicine, and I'm trying to do public health. But take the next question, Naomi. Let's see if we can get into this other part.
Yeah, okay. So yeah, totally, Charles. At least I happen to be in the medical field, so that's why it's mostly like normal for me, but still people still don't understand it in real context. So but yeah, hopefully like in the next years we will see a different transition and people will accept it more as a profession and understand it. And for the next question we're trying to address is why do we actually think it's difficult for people to grasp it and the perception or the perceived idea on our career prospects as a public health? So, in short, it will be like, what do you do as a public health
Mm-hmm.
person,
Mm-hmm.
specialist?
Mm-hmm.
And maybe for me, I would start by saying, like I mentioned before, it's not a clearly defined profession. So, for example, when I finished medical school, like everybody knows that, okay, as a doctor, you either become a general practitioner, and these are your competencies as a general practitioner. And then if you're an engineer, everybody knows what you're doing. But then as a public health person, what do you actually do?
Mm-hmm.
And I think this issue with the grasp of what public health practitioners do, because already the field is very interdisciplinary, so you acquire a lot of skills, but then somehow it's just like I could do this, but it's really difficult for you to explain for people to understand. And except you're a public researcher, then you could be like, oh yeah, I research like public health issues or something.
Mm-hmm.
So that's one of the reasons why I think so. And Charles, yeah, what about you? What do you think?
Yeah, I definitely think that like you've begun to like hit the nail on the head there. I really think that to be fair, it isn't other people's fault that they don't understand what public health is about, and I think it's primarily how public health has been marketed as a educational pathway and a career field. Um, um, Most places that teach public health happen to be teaching it out of a medical school. And so it's very often you find that the field is dominated by persons who either have a medical or a science background because you're associating public health with medical school. And so, if you're a person who didn't really think that science was a thing for you, or felt like medicine was a thing for you, you may feel less inclined to want to go into this particular field, and um, and that's a problem, right? I have great respect for a lot of the colleagues that are in our classes who come from a medical background. I'm going to call it like this identifiably like direct medical background. So
Mhm,
doctors, nurses, and like the allied health professions, right? But the issue really has to boil down to is how is public health being perceived? Is it a natural science? Is it a social science? Is it a medical science? And all this confusion comes into play. And like even when we think about like from my situation back home, we have a Department of Public Health. And I'll be quite honest, the first thing that people think about when they hear the Department of Public Health, they think about the public clinics, they think about the doctors, and they think about nurses.
mhm,
And they think about how is the public clinic system actually
mhm,
helping them. All right.
mhm,
So I think that's really why it's so difficult for people to grasp what public
mhm.
health is about, and I think
Yeah.
leads us pretty strongly into like the like last question, which is kind of getting into what can we do to better highlight that public health is an important career or a field of study, right? And I personally I don't know, Naomi, did you want to take this, or like, do you want me to like keep going?
Yeah, well, I think like you could keep going, and I will add more to it.
Okay,
Yeah, at
okay.
this point, yeah, no,
All right.
totally.
The reality that I see about this is that public health touches our daily lives, and there's tons of YouTube videos and things that you can go out and see exactly what public health is about.
Mhm,
But I think to boil it simply, public health is all about my health and your health, and the
true.
fact that all of our health is strongly shaped by the world that we live in,
Mhm,
and these issues related to globalization of health really strongly links us all, right? From the type of like health laws that come into play,
mhm,
from the travel of people into countries to the type of medications that we get, even the type of policies that you see being debated
yeah.
on, and I'm taking up a lot of national discourse, like in the US with Medicare for all or whatnot. But the big thing is that public health workers are really in high demand around the world.
Mhm,
I saw a stat that had noted that by the year 2020, that the world needs about 250,000 more public health workers in order to meet the world's health needs.
yeah.
And I want people back home, like when you're thinking about the Department of Public Health, don't just think about the clinics, all right? I want you to think about what's the role do they play in vaccinations? What's the role that they play in like poison control and vector control and quarantine protocols, and how that connects to national security or in port health with aviation and tourism and national security ruling in, and the regulation and manufacturing of drugs, and how that takes finance, that takes national security, that takes trade, architects, business managers, human resource people, caterers for these various types of uh, um, clinics, and for the community, and educators. They all can play a role in public health.
Mhm.
So I don't know, Naomi, what do you have to add to that?
Ah, yeah, okay. So clearly you've said everything, but I would add the fact that also it's the work of also maybe us public health students, I would say, and existing public health professionals to begin to realize that our field is just more than like, yeah, like just a public health. So maybe we could push more towards us being recognized as we're really important for the health workforce and not just like every other field. So I don't know, maybe that will be upcoming policies that we have to come out like with coalitions to fight for public health
Mhm.
becoming a recognized field and stuff like that. But I would say that is a way to go. And also we have to define our competencies. Like there's a lot of public health schools there, but then everybody graduates with different competencies. So like now you graduate from maybe the US, you come to the UK, like you have done different things. So maybe there's a way to like really measure that because even with medical school, for example, if you graduate from the US and you come to another country, you're expected to take an exam, but then it's not very, very difficult. It's just that maybe the terminologies are different, but then you're expected to have covered specific, points and
Mhm.
curriculum. And maybe that's another thing that it might make, there might be the argument that it will make the profession not as, flexible as it is. But I think it's also, since it's being seen as a very important field with regards to health, then I think we should do more work towards making it very defined as a profession. Like, even though it's not going to be as rigid as medicine, but at least like there should be expectation in terms of competencies that a public health a professional would have, so that we will know what to expect from you, and people will begin to understand more what you do because yeah, then you can do this, you can do that. And I would say that's mostly on the, let's say, technical side,
Mhm.
on the terms of like maybe government or NGOs or like people affiliated with like public health or schools of public health could actually consider doing. So that for me, I would say it's important
Okay.
at the moment. Yeah.
Yeah, all right. So I know that we're getting towards the end of this podcast, but just like with school, I think that and it's important that we are able to recap some of the main points that we want people to take away
Mhm.
from here. So I see some emerging issues coming about, which is that really public health is a field that anyone can study and pursue as a career. That's what I see as like a main point taking out of this.
Yeah.
What about you, Naomi?
Yeah, for me, I would say that as I keep emphasizing, public health is a field that's very diverse and interdisciplinary in nature, and then is the fact that it's still a field that is been like it's practically new. I would say it has always been there, but the realization of this field is new, so it's still a work in progress. But and also that because it's a work in progress, there's so much you can get involved in public health. For example, Charles mentioned quite a bunch of areas, like it's as close as aviation to as far as I would say maybe finance or something.
Mhm.
So there's so much you could do, but then I think one of the advice I would say in terms of this issue of it being diverse is also it's like pros and cons, and it's really important, like if you're thinking of a public health career, to like have a niche area. So like where do you want to actually see yourself working in public health? Like it always helps when you have like a focus point. So for example, Charles introduced himself as a public health communicator, and he's into public health communications. And for me, I would say I'm interested in health systems and policy. So that's where I build my network, and then it's easy for you to contribute more. And then as you go, you could be interested in migrant health, and then you could diversify. And but it's really important to build your knowledge and experience in that particular area of interest, and then you grow along the line. Also, so yeah, what else do you have for us, Charles?
I really, really want to be able to emphasize, like, from what you said, that really public health really touches our daily lives, and that we all contribute to public health in some way, either professionally or personally. And I think that the things that people don't recognize that is related to public health. Like you have to very like clear getting vaccines, but the promotion of like smoke-free areas, to the design of buildings and how that impacts health, to an engineer designing water filtration systems, and
Yeah,
people thinking about bike paths, and
exactly.
uh, thinking about good quality sexual
Laws,
education, and like good work laws, right? Public health is everywhere, and I just definitely feel as though 20 minutes isn't enough time to be able to cover all of that. So that's
yeah,
why we hope that you will continue to follow these episodes, these podcasts, as we expand on some further topics.
yeah,
And
yeah.
we hope to be able to do these type of stuff every Saturday, right?
Yeah. So we hope that every Saturday. So we're trying to keep it as simple as possible. So it's going to be for now once in a week, every Saturday at 4:30, and it will be live next episode. So we decided to have a demo version, which is today,
Mhm,
to introduce you into the podcast. And as we go on, we will also introduce speakers to come talk to us apart from us
mhm.
too, and we will explore the topics of public health. Yeah.
Yes.
Right, Charles.
And so, if there's any topics or areas that you'd like to be discussed as well, feel free to leave those topics either by for persons who may know us personally, just contact us. We will be putting this up on various media channels, so you can just
Yeah.
comment and leave a topic. But we have a whole list that we plan to go through. So I guess not to make this drag on any longer, we hope that you enjoyed this first episode of Talk Public Health, and I guess we'll see you next week.
Yeah, just to add one more point,
Mhm.
maybe you could also like comment, like, so if you have some comments from what we discussed that you want to contribute, feel free to leave a chat or comment on the video so people can discuss. So we encourage discussions.
Mhm.
So see you next week.
Okay. All right.
Bye.
See you later.